So we are here doing a head-to-toe assessment. Can you tell me your name and age?
Drew, 34.
Okay. And can you tell me the date?
Sunday the 6th.
Okay. And do you know where we are?
Alma.
Okay. And do you know why we're here?
A head-toe assessment.
Head-to-toe, yeah. Yes, my patient is alert and oriented and has an appropriate level of consciousness. He is also appears as his stated age. In general, he has a good appearance. His skin is a normal color. He is dry. He looks a little bit cold, which makes sense because it's cold in here. But besides that, he has good posture, and he appears appropriate. So the and then his chest, there's no barrel chest. His A and P diameter is normal. There's no obvious deformities. He is breathing and has equal chest rise when breathing. So the first thing I'm going to do here now, Drew, is I'm going to listen to your lung sounds. Okay. So go ahead and take a deep breath for me. Good. 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 Okay, I'm gonna listen to your back. Nice deep breath. Good. Deep breath. Good. Good. And last one. Okay, breath sounds are clear and normal and equal in all lobes of the lung. So the next thing I'm doing is I'm going to take a listen to your heart, and I'm going to re-listen to a full minute so that I can get an apical heart rate, okay? Okay, so apical heart rate is 57 beats per minute. There are no murmurs or adventitious heart sounds. So that is great. So next thing I'm going to do is I'm looking at your upper extremities. I'm going to feel your radial pulse. Strong and equal bilaterally. And then I'm looking at range of motion for your fingers and your wrists, elbows. Okay, and then your shoulder. Okay, same thing on the other side. Range of motion for your fingers is normal. Wrist is normal. Elbow. Okay, and then shoulder. Okay, range of motion is good. Temperature is warm. And then I'm going to check the strength in your hands and your arms. Okay, so go ahead and squeeze my fingers. Okay, perfect. Put your arms straight out in front of you. Okay, and then push down on my hands. Okay, and turn your palms face up. Okay, and I'm going to push down your hands and try to resist my force. Okay, great. Wonderful. So he is strong equally in both arms. All right, so next I'm going to check your abdomen. So I'm going to have you lay back. Okay, and the first thing I'm doing is I'm inspecting his abdomen, and it is pink, warm, and dry, and there's no abnormal pulsations or anything like that. And so I'm going to go ahead and listen to bowel sounds. So bowel sounds are present in all 4 quadrants. The next thing I'm going to do is palpate your abdomen, okay? So I'm going to start with a light palpation. Just let me know if you feel any tenderness or pain or anything, okay?
Okay.
Sorry, my hands are cold. Okay. Any, are they that cold? Any tenderness or pain or anything?
No.
Okay, so now I'm going to do a deep palpation, so I'm going to push a little bit harder. Sorry. Okay. Any tenderness?
No.
Okay, so his abdomen is soft and non-tender in all 4 quadrants. So the next thing I'm going to do is I'm going to take a look at your lower extremities. You can put your legs out. Okay, so equal or normal hair growth, skin is pinworm dry, no obvious deformities. I'm going to take your socks off. Okay, and I'm feeling for the posterior tibialis pulse, which is equal and strong in both, and the pedal pulse, which is equal and strong in both, and there's no deformities or ulcerations or anything like that of his feet. And wiggle your toes for me. Okay, good range of motion of the toes, good range of motion of the ankles, and then range of motion for your knees. It's good. Good. Okay. All right. So, you can go ahead and sit up. Okay. The next thing I'm gonna do is I'm gonna check your cranial nerve functions. So for the first thing, I would like you to close your eyes. Okay, and then tell me if you can smell anything.
Rubbing alcohol?
Yeah. Yes. So that was an alcohol pad. Okay, you can open your eyes. So cranial nerve 1 is intact. Okay, and then the next thing I'm gonna do is I'm gonna take a look at your eyes and your pupils. So I'm gonna hold this pen light, and I would like you to just follow it with your eyes, but try not to move your head at all. Okay. And still, one more, okay. Okay. And then I'm going to shine this light in your eyes, and I'm looking in to see how your pupils react to the light. So if you could just look straight ahead at me. Okay. Can I try that again? Okay. So pearls are equal, round, reactive to light, and accommodating. Can you smile for me? Okay, and show me your teeth. Okay, and tightly close your eyes. Wonderful. And then I want you can open your eyes again and clench your jaw for me. Okay, strong on both sides. And then try to puff out your cheeks with air. Okay, and blow it out. Okay, wonderful. And then close your eyes for me, and I want you to tell me when you can feel a touch.
Yep. Yep. Yep.
Okay. All right, and then open your eyes and stick out your tongue and say, ah.
Ah.
Okay, perfect. So his cranial, one more thing. I'm going to push on your chin, and I just want you to resist force against it, okay? On both sides. Okay, shrug your shoulders for me. Okay. And then resist force against that's what I meant. Thank you. To push up. Okay, so cranial nerves are all intact. So the next thing that I want to test is your cerebellar function. So we're going to do a couple of tests. The first thing is a rapid alternating movement test. So I want you to take your hands and alternate from palm up to palm down on your knees as fast as you can. Wonderful. You did that perfectly. And then the next thing I want you to do is put your arms out and then alternate with your index finger touching your nose. Okay, wonderful. And then I want you to do the same thing, but this time I want you to touch my finger in front of you. And alternating with each hand. Okay, perfect. And then the next thing I want you to do is to take the heel of one foot, and I want you to rub it on the shin of your other leg, and then the same thing on the other side. Okay, and he was able to do that perfectly. So cerebellar function is all intact. So I want to check your gait. So if you could walk up and just walk from that end of the room to the other. Okay, perfect. Gait is normal. Okay, and then stand up for me. Legs, feet together, arms at your side, and then close your eyes. Okay, this is the Romberg test. Testing for balance. He's got good balance, a little bit of swing, but nothing abnormal. You can go ahead and sit back down. All right, so the next thing I'm going to test is your sensation. So I'm going to start with dull and sharp pain. So I'm going to close, or not pain, but sensation. So I'm going to close your eyes, and then I'm going to touch you, and I want you to tell me if it feels dull or sharp, okay?
Dull.
Good.
Sharp. Sharp.
Does that feel sharp?
Dull. That's sharp.
Okay. Oops. Oh no. I dropped it. Can you move your feet? I dropped it. Oh, there it is. Okay, sorry. All right, ready? Now close your eyes and tell me if it feels dull or sharp.
Dull.
Okay.
Sharp.
Okay.
Dull. Sharp.
Okay, great. So that is all intact. And then I'm going to test your sensitivity to light touch. So I want you to close your eyes and tell me when you can feel this, or if you feel anything.
Feel. Feel. Feel.
Okay, perfect. All intact. Okay, so thank you so much for participating.
Good job.